Story opens in a hospital room with Mr. Lee and his wife Sally Mae. They are waiting for the discharge nurse to come tell them it's time to go home. They have several questions and wish to leave as soon as possible. Mr. Lee had TURP surgery on his prostate yesterday morning due to urine retention and repeated UTIs.
Oh my goodness. Oh my goodness. I really wish this doctor would hurry up.
Yeah, me too, baby. You've heard the old saying, the junk in the trunk? It feels like somebody put my junk in the trunk and slammed the lid on it.
Oh, you be still, Bruce. Don't embarrass me like that when the nurse comes in.
Now, honey bun, you know I wouldn't ever do anything like that to you.
Shh, here she comes.
A knock is heard at the door.
Hello, nurse. Hey.
Come in.
Hi, I'm Nurse Ratchet, and this is Nurse Espinosa, and we'll be assisting you today with your discharge.
Really? Nurse Ratchet?
Yes. Do you have any questions?
Yes, I'd actually like to know how long will it be before, you know.
Now, honey, what she's trying to say is she wants to know how long it'll be before we can commence to making sweet, sweet love.
That's not what I was going to ask you all.
That's what I wanted to ask.
Well, sorry, but it'll be no sex for about 4 to 6 weeks.
Well, actually, what I really wanted to know was when his catheter would be removed.
Okay. Well, you're going to have a follow-up appointment, let me see, tomorrow at your urologist office at 2 p.m. He'll let you know when it's going to be removed. Let me see. Your urologist is Dr. Seymour Weiner. Is that correct?
Yes, he is the new doctor over in the old building with old Dr. Philip McCracken, the proctologist.
Well, you will actually need to limit your activity and rest for a couple days after getting home. Your doctor can tell you when you can resume your normal activities.
I'm worried about the catheter and taking him home.
Now, don't worry, honey. They already said it'd be 4 to 6 weeks before we could commence to boom boom again.
Oh, be still.
Your doctor's office will help you with any scheduled care that you need. And we're also going to give you a list of precautions to take home with you and how to safely empty your urine bag before you leave today.
Okay, that makes me feel better.
You will also need to watch if his urine becomes consistently bloody like tomato juice for more than 24 hours or so. And if so, call Dr. Weiner's office. And now he will have periods of bloody and then clear urine, and this is normal for up to 6 weeks after surgery. Anal itching is also common, and it is normal for the tip of the penis to sting or burn as the surgery site heals.
How's that? Say what?
Shh, she said it's just going to sting a little. Just be quiet and let the lady talk.
Mr. Lee, do you understand the instructions I've given you so far?
Well, let's see. Got an appointment tomorrow at 2. My wiener's gonna hurt, and my butt's gonna itch. I think I got it.
Good, Mr. Lee, good. Now, you're also going to need to contact your doctor if you're unable to urinate. If you've got a swollen tender calf, a swollen tender testicle, or you have a fever over 101. Now, we're going to send you home some literature, so don't worry about how much information we're going to give you today. We'll send you home with all that stuff.
Now, wait a minute. Did I hear somebody say something about... Now, wait a minute. Did somebody say something about a swollen testicle?
Yes, it is something that you can have, and you need to talk to your doctor about it if it does occur.
Okay. I'll just call a doc if my boys begin to swell, right?
Right.
That's right. And also remember to drink plenty of water as well as eating a high-fiber diet.
Is there any restriction on how he can lie in bed?
No, he will just need to take it easy and rest in whatever way is most comfortable for him. While we're on the subject of activities, there are a few more things that you should know. No long car rides for more than 4 to 6 weeks. No lifting over 10 pounds, such as anything heavier than a gallon of milk. You can take showers, but no baths. Resume taking your normal medications, and if you need to take a laxative, you can also do that, as well as taking a high-fiber diet to avoid any constipation.
Yeah, but do I get any good drugs?
You will have a prescription for antibiotics for infection, and you need to remember to take all of these as prescribed, which you'll also have medication to relieve spasms, and some pain medication is needed.
How long before I can go back to work?
Your doctor will need to decide that as well as to when you can start driving. Mr. Lee, can you tell me what I've told you so far?
Let's see, call the doc if my boys begin to swell, no lifting, no long car rides, and I can shower, but I don't get in the bathtub.
Anything else we need to call the doctor for?
Really, anything that your pain medicine is not taking care of, you can have drainage out of your penis. It can be yellow, green, or pussy, or even a milky color. And also call Dr. Wiener if your catheter site is leaking or you have pain near your catheter.
And I know this is a lot of information, but here's everything that we've talked about today. And if you have any further questions, don't hesitate to call Dr. Wiener's office.
Okay, thank you guys so much. I feel so much better about being able to take care of him at home now.
Well, you're welcome. I'm glad you feel better. And if there's no other questions, we'll go ahead and get your discharge started.
Oh, I'm good.
Yes, thanks. I believe we're ready to go now.
Scene fades, and in the weeks to come, Bruce finds that pain ceases, burning stops, itching subsides, and urine flows.
Jeez.